I now move and invite the representative of the Russian Federation to present his statement. The floor is yours.
Thank you very much, Mr. President. Today's briefing on the topic of vaccination in the context of armed conflicts, post-conflict situations, and complex humanitarian crises is a timely one. We thank the speakers for their useful overview of the global situation in terms of ensuring universal immunization against COVID-19 in the most challenging conditions, as well as recommendations for improvements on this track. In light of the responsibilities of the Council and the guidance provided by its resolutions 2532 and 2565, we would like to note the efforts of the UN Department of Operational Support to organize a proper vaccination campaign among peacekeepers. We also welcome the establishment by the WHO, UNICEF, and the Gavi Alliance of the COVID-19 Vaccine Delivery Partnership, which is designed to strengthen the coordination of relevant efforts. This is especially important given that logistical problems and the ability of national health systems to ensure that received vaccine doses are administered are problems that are now coming to the forefront, and this is primarily due to an unprecedented number of illegal sanctions. In this regard, we trust that by improving the coordination and effectiveness of these activities, it will be possible to increase the vaccination rates in the 25 countries most in need, where vaccination coverage currently does not exceed 10%. We also hope that it will be possible to swiftly set up the work of the so-called humanitarian buffer focused on the most vulnerable categories of recipients as part of the framework of the multilateral COVAX mechanism. It would be interesting to hear the briefer's opinion on how to address problems hindering this process, particularly the legal issue of indemnities. Unfortunately, as is traditionally the case, we did not hear any analyses or assessments of how the goal of achieving universal vaccination is impacted by unlawful unilateral economic coercive measures that undermine the health systems and economies of the countries affected. We regret to note that this topic continues to receive a lack of attention in the Council, which does nothing to improve the situation. Other factors that deserve attention include delays in national and international approval of anti-COVID drugs, expanding access to technology and supply chains, and combating disinformation and vaccine hesitancy. Russia, for its part, also possesses experience in helping to combat COVID-19 in difficult conditions. Thus, we have delivered millions of doses of vaccines and testing systems to foreign countries, including to countries on the Council's agenda, for example, to colleagues in the Syrian Arab Republic. According to the latest data, our country is currently hosting more than 730,000 citizens of the Donetsk and Luhansk People's Republics and Ukraine. Refugees can access COVID-19 testing at accommodation centers and medical facilities, and if they wish, they can also be vaccinated with the vaccines used in our country or receive free treatment for COVID-19 on an equal footing with Russian citizens. We are continuing to work on improving our response to the novel coronavirus infection at the research and development level as well. Thus, at the beginning of this month, a nasal form of the Sputnik V 2-dose vaccine was registered in Russia. This is to be administered using a special spray nozzle. We would like to note that according to Resolution 2565, information on its implementation should be provided as necessary and also as an option as part of the ordinary reporting of the special representatives of the Secretary General, where and when that is truly required. We would consider this mode of discussing this issue within the Council to be optimal. To conclude, we are forced to respond to the statement made by one delegation, which insists on continuing using practically every meeting of this Council to attack our country. We have repeatedly provided clarifications regarding the special military operation in Ukraine, and we do not intend to go back to this topic now. Thank you very much.
I thank the representative of the Russian Federation.